Hi, I'm Dr. Paul Hoard, one of the co-founders of Praxplay, and I want to show you a little bit about how the site works. Once you have created your account and logged in, you should see something like this. For today, let's head over to the practice lab and show you how it works. Here in the practice lab is where you're going to be able to both create personas and then start conversations to practice that. So to start creating a persona, we're going to come over here and just click that. And as you see in this diagram, you're able to actually fill in the information yourself if you would like to create it all. Or if you'd like some help generating some of that, we can hit this randomize button and the system will generate some information for you. After it's been generated, you are still able to edit anything you'd like to be more of what you are looking for. Once we have some basic information about the persona, then we want to move over here where we can start giving them a background and some high points and low points. Again, for this demo, I'm going to go ahead and let the system generate some of this for us. Now, we can actually guide the system a little bit by giving more of a prompt if we want to push it in a certain direction. For example, I may ask it to work with a young professional dealing with anxiety. But for now, in this demonstration, let's just hit generate and see what happens. Here's what the system's giving us about Jordan. And this is the point when it's really important to make sure if you do have the system generated that you just take a moment to review what it has given you. And so you can read their entire background story. And this is what the system's going to use in order to talk and interact with you in a more human-like manner. On top of this background story, we also are going to have a few high points. You can add your own here if you like, or remove or edit the ones that are given here. It's also going to have some low points. These may or may not make it into any conversation, but they help the persona be a little bit more lifelike as it's interacting with you on the system. So let's keep moving forward here. Now, once again, we've got a place where we can manually fill in some presenting concerns and other aspects of them, or as we have done before, we're just going to let the system generate this for us. If we scroll down here, we can see that the system is giving Jordan some pretty high anxiety, as well as isolation, emptiness, avoidance, self-doubt. Now again, if you wanted to add a more particular concern, presenting problem, you're able to do that right in this box right there. Our system uses the big 5 personality traits, and so you'll see how the system has already generated that in a way that would be consistent with the story. But if you wanted to edit any of those, you are able to move those sliders along to change how they all fall. But since we already let the system generate that, let's just keep going. This is the last page where you have one final time to sort of edit any other details about the persona before we go ahead and create them. Here we have Jason Harris is the new persona we've just created, and now I'd like to show you how conversations work here. Once you start a new conversation, the first thing it's going to ask you to is to tell you, okay, so what is the context of it? My account is set up for mental health private practice situations, so already mine's defaulting to clinical scenarios. So is this the intake, rapport building, working, or termination phase? For this demonstration, I'm going to click on working. And where are we at in the conversation? Let's go ahead and start at the beginning of a conversation. Here, we then have an opportunity to sort of set the receptiveness level, which is essentially how open is the persona going to be in working with us. Are they going to be far more receptive or a little bit less receptive and perhaps more guarded? The system's also asking for a location, and so since I'm in a private practice, I am more geared towards mental health, have the opportunity to just click that or to select a different setting for this. For now, let's go ahead and just do private practice and let's move forward. Again, because my account is geared towards mental health, I can click approaches that are more adjacent to various mental health approaches. For this one, I'm going to go ahead and select cognitive behavioral therapy, but I don't need to select any if you don't have a particular approach that you're trying to focus on or a particular skill. For this example though, I'm going to go ahead and click on open-ended questions and encouraging. This helps guide the conversation in the sense that it won't actually impact what the persona does, but it does impact the feedback I'm going to be getting at the end so that I can learn from the experience. And So then this is just one last chance to look at everything before we launch into a conversation. When you start a conversation at the beginning, it's going to allow the persona to set things up and to start first. Here we have Jason's first response to us, and let's have a small conversation and see where this goes. I'm going to play out a few more interactions and fast forward a bit so that we've got more of a full conversation. So now I've had a few interactions with Jason in this conversation, and he's beginning to open up a little bit more about his anxiety and his isolation, but Praxplay actually has a few tools to help us in case we're getting stuck or kind of want to understand a little bit more of what's happening. So if you click on the three buttons underneath Jason's name, or you'll see there's similar ones that are under mine, we have some options to either give ourselves a note, or what I want to show you right now is to ask the AI supervisor a little bit of perhaps a question about what's going on. So let's give a simple, what should I do next? And this is a little bit of support that Praxplay offers, which you can toggle on or off during a conversation to help you consider what's going on and to try to improve your skills in the moment. From my question, what should I do next? Here's a little bit of insight that Praxplay is giving us based on where things are at right now. So it's got a bit of a summary of what's happening and then a direct answer to some questions of ways that we could go forward and things that we may want to watch out for moving forward. Now, if we're interested, I could continue this conversation kind of as a sidebar with my AI supervisor to get a little bit more information or maybe to clarify if I wanted to. Otherwise, I can simply collapse this and then we can continue on with the conversation. Now, if you need to step away from this conversation, you can always toggle away and this will be saved for you to be able to return to. But when you're done with the conversation, we're going to move over here to these three dots and simply hit End and Review. And so once we click End the session, it's sort of warning you that we'll be done with this entire time. When you end a session, this is the view that Praxplay will take you to. And here is where we can both look at a detailed report, but also just from this dashboard, get a sense of how Praxplay is going to be rating our conversation and how things went so far. So over here we have a summary of some of the skills and approaches that we said we wanted to work on, along with a list of strengths and areas for improvements. When we select one, you have a little bit more of a detailed analysis. Additionally, an option to see where exactly in the transcript the feedback is coming from so we can dial into when that happened and what the encouragement from the system is on how we can improve. And that is available for the strengths as well as the areas for improvements. Additionally, if you want to view the actual full report, you can click on that, and then here is a far more comprehensive document that Praxplay develops after each of your ended sessions to help you look at your skill assessments and the goals that you were setting for yourself, as well as your approach and areas for improvement. And those will be saved so you can always go back and review those later. Additionally, if you want to have a further conversation sort of with the AI supervisor about how you did, you can ask some questions here to have more of an interactive feedback session. All right, thanks for listening, and I hope this was helpful.